Diabetic nephropathy, or kidney disease, is a complication of type 2 diabetes. It can lead to kidney failure and even death if left untreated. The test presently used to diagnose it looks for albuminuria, or protein in the urine. Several new testing methods have been trialed in an attempt to diagnose the condition earlier and begin treatment long before diabetic nephropathy can advance to kidney failure. Early treatment can prevent serious consequences. Researchers at the College of Medicine and Health Science, Wallo University, in Dessie, Ethiopia, reviewed 42 studies of various molecules measured in the attempt to diagnose diabetic nephropathy early. Their work was published in Biomarker Research in July 2015. The molecules measured included neutrophil gelatinase-associated lipocolin gal, N-acetyl beta-glucosaminidase NAG, cystatin C-alpha-1 microglobulin, immunoglobulin G, immunoglobulin M type IV, collagen, nephrin, angiotensinogen, and liver type, fatty acid binding protein L-FAB. The urine from the type 2 diabetics had higher levels of each of the above molecules than did the urine from non-diabetic participants. The molecules correlated well with urinary albumin in some diabetics. It was also seen in several other diabetics without urinary albumin, leading researchers to suggest testing for the molecules above could find diabetic kidney disease early. It was concluded further large studies are warranted to learn whether testing for the above molecules could be useful to screen for early diabetic nephropathy in type 2 diabetics. Diabetic nephropathy is seen in as many as 50% of diabetics who have had diabetes for more than 20 years. The condition is a leading cause of kidney disease in Western nations and is one of the most serious complications for many. It causes 30 to 40% of serious kidney disease in the United States. People diagnosed with diabetic nephropathy usually produce a foamy urine due to its abnormally high protein content. Kidney disease can be diagnosed at about the same time as vision problems, fatigue, high blood pressure, swollen feet and ankles, and heart disease can also be present. When diabetic kidney disease is diagnosed, the condition is often treated with losartan Cosara drug that helps keep blood pressure low enough to prevent further kidney damage. Sodium and sometimes potassium restriction are used to keep salt levels from becoming too high and causing high blood pressure. Artificial dialysis is sometimes necessary when dietary restrictions alone are not enough. Tubes are surgically placed in the diabetic patient's arm and used to move their blood through an artificial kidney. When the kidneys fail entirely, transplants can be performed from donors with the same blood and tissue types. Early diagnosis and treatment could lead to less failure.